Introduction of the features, precautions, and usage of the refined Maxsurgery 3 basic kit. Surgery tip model US1 and US2 are very similar to each other. This is US1. It has 5 teeth in an arc, spreading out like a fan, and the whole blade is a little bit thick, so it's the effective cutting area is the fan-shaped edge at the front. If you go deeper, the tip will get stuck by the cylinder at the back and won't go down. US1 is specifically designed to cut cortical bone. That's why it's also called a cortical osteotomy tip. The US2 also has 5 teeth, but unlike the US1, the teeth are in a straight line, and the whole blade is thinner than the US1. It's also thinner here at the back, so it can cut deeper than US1. The side of the tip has graduated points to determine how deep the cut has gone down. The first point is 7 mm, the second is 8.5 mm, and the third is 10 mm. Let's take a look at these two similarly functioning but differently shaped tips. US5 is for bone reshaping and bone chip collection. The front of the tip is flat, so the bone surface is flat. The US4 is shaped like a spoon and can also be used for bone reshaping and bone chip collection. It has more working surfaces than the US5. The entire arc can be used for bone reshaping. It can also be used to debride the mucosa when lifting the maxillary sinus. The UL3 is a tip with a diamond head. Its main function is to grind and debride the bone. In clinical practice, it is usually used for debridement close to soft tissues. For example, when lifting the maxillary sinus externally and internally, the bone is removed close to the mucosa. The remaining 0.5 to 1 mm of bone tissue can be ground off with UL3 to ensure maximum safety. In addition, its head is adamantine, which is also very effective in removing inflammatory bone tissue and in debriding bone surfaces. UC1 is one of the most commonly used tips. Its tip edge is bladeless on both sides of the base. Its main function is to excise the periodontal ligament and create a gap. These are briefly introduction of refined Maxsurgery 3 basic kit. Next, let's go through each of them one by one. The US1 is also called the cortical osteotomy tip. The tip vibrates ultrasonically when the blade is in operation. When we apply a certain amount of pressure, the tip moves over the bone and cuts through the bone. It's used like a saw to cut in a back and forth motion. In addition to moving back and forth, there is a lifting motion to keep the water cooling down to the cutting area. Firstly, step on the foot pedal to make the tip vibrate with water. When cutting the bone, we put some pressure on the handpiece, about 1 pound of force. When you cut the bone, you can hear the sizzling sound like this. That means the cutting efficiency is the highest. At the same time, pay attention to lift the tip, because the side wall of the tip is close to the bone surface. If you don't lift the tip, it may burn the bone. US2 is also called the cancellous osteotomy tip. Again, tighten with a torque wrench. The 5 teeth are parallel to the bone surface, so that the force is more uniform. It minimizes wear on the tip and provides the best cutting efficiency. If you cut at an angle, a certain tooth will be overloaded and wear out easily. Try to avoid using US2 to cut in this way. If use US2 to cut deeper, the requirement for lifting is even more stringent. It has to be lifted. Don't cut all the way under the bone. Pull back and lift like this. Pull back, lift. That's how you cool the tip sufficiently. If you apply too much force, the machine will determine that your tip may be stuck. To protect the bone from burns and the tip from damage, it will reduce the power accordingly so that the tip can be released first. US5 is also called a bone dressing tip and bone planer. Its main function is to plan and reshape the bone. Its working part is at the very front. It's the edge that scrapes away the excess bone. In the process of scraping, a certain amount of pressure is applied. Scraping from front to back creates bone chips. In addition to trimming, it also collects bone chips from your own bone. The bone chips are flakes that won't be washed away by the water, making it easier to collect and minimize loss. US4's head is like spoon. It has 2 main functions. One is similar to the US5, bone reshaping, but it is more delicate than the bone planer. Secondly, it can peel off the mucosa when lifting the maxillary sinus. Let's show you how it can be used for bone reshaping. It's similar to the bone planer, but it's got more angles. It can scrape vertically, sideways, or at an angle. It's easy to maneuver because it's edged all the way around. Next, we will simulate the peeling off operation on a raw duck egg. US1 is recommended for opening the window, the one with 5 thicker teeth. The process of opening the window is the same as cutting the bone. When you hear the sound of the bone being cut, it is the most efficient moment. If there's no sound, it's probably not cutting. The membrane is not broken after opening the window. You can put the tip directly on the membrane without breaking it. When stripping the mucosa in the maxillary sinus lift, the bone and membrane around the window are peeled away, and then fill it with bone powder. Our tip has a smooth side and the other side is a little bit rougher. Use the rough side against the bone wall and the smooth side against the mucosa. Vibrate the tip first when we peel it off, and then gently press down so that the tip is embedded between the bone and the membrane, and move it slowly in and out, because it doesn't peel off by pushing on it. It's through the cavitation effect of ultrasonic vibration, the impact of water, microfluidization, etc. that separates the membrane. Therefore, to use Maxsurgery 3 for mucosal separation is safer than other surgical instruments. The eggshell in the center is also entered with a smooth surface against the mucosa. Then we remove it. It must be moved slowly. UC1 is almost always the most used for extractions to increase the gap. Because of the high volume of extractions, it is important to know how to use the UC1 properly. UC1 has a flat edge. The side of the tip has no edge, so there is no cutting force. Only the front of the tip has an edge. This is the effective work area of UC1, to lift and cut with the front end. Don't move from side to side when making a gap. Here's a demonstration. First, determine the shape of the tooth and go down against the surface. Place one side of the tip against the tooth surface and lift vertically up and down. It is also possible to open the flap slightly to allow more room for maneuvering. Some professors may think of improving efficiency when increasing the gap. There is no need to pull the flap to the side, because there is no edge on the side. The pulling action is ineffective, and this operation stays under the gingiva for too long, and can't cool down in time. The soft tissue may also cause damage. The recovery after the operation will be slow, against our original intention. That's why we have to do it this way. There is another situation. If you can't get the tip to go down when you're increasing the gap, you'll hear this noise. It may mean that the tip is cutting into the tooth. You need to adjust the angle, so that the tip can cut in the direction of the periodontal ligament gap, and it will be more efficient. There will be a little bit of resistance at the beginning when you increase the gap, as the tip cuts downwards. Press down, lift up, press down, lift up. Where the gapping has been completed, you will feel a sense of hollowing out. That means it's done. UL3 is spherical with diamond. It's got to be used for bone grinding and debridement. It has two main functions. One is to debride the bone when it's close to the mucosa. The second is to debride the surface of the bone to remove any inflammation. The most important advantage of UL3 is unlimited working angle. This whole ball can be used on all sides to grind the bone. It can be used frontally, obliquely, or laterally, but at the same time, it also has a shortcoming. The efficiency of bone removal is lower than the tips for cutting. Usually, it is used when the bone is close to the mucous membrane. It's also more often used for bone surface debridement.